Hello, everyone, and welcome. Today, I'll be sharing our project from our ALX Professional Foundation team activity that is promoting health of farmers through investment. We are Team Green Pulse. This project is called Healthcare Access, the link between farmers and investors. It has been put together by Courage Beku, myself, Brenda Waweru, Anitwa Yvonne, Natesi Abigail, and Mawena Amenyo. Let's look at the problem we are addressing. Small-scale farmers in rural areas face big financial barriers when it comes to accessing healthcare. This connects two key areas, healthcare accessibility and agriculture, as well as technology. When a farmer gets sick, it's not only about the farmer, it's about his livelihood, his family, as well as the functional food security. We simply cannot have an economy without a healthy workforce. Meet Coffee. Coffee is a 52-year-old maize farmer in Techiman, Ghana. He works hard, but his family often struggles because of limited healthcare access. Imagine this: one bout of malaria or even a broken bone can completely wipe out his savings. Sometimes he has to make tough choices between buying medicine and providing for his family's basic needs. Coffee doesn't have health insurance, and the nearest clinic is far away. He needs a solution that turns his hard work into real well being for himself and his family. This isn't just Coffee's story. It reflects a bigger challenge. Studies show that in northern Ghana, around 53% of urban residents had health insurance, but in rural areas, that number drops to just 38%. Even though this data isn't found, it highlights the sharp rural to urban gap in access to health protection. When illness strikes, the financial burden is huge. For example, in rural southeastern Nigeria, female-headed households spend about 12% of their income on healthcare, while male-headed households spend about 10%. That's a big portion of their monthly expenses, and it shows how vulnerable farmers are when they have to pay out of pocket. Agriculture contributes between 15 and 18% of GPD in many African countries. But the reality is, small farmers producing most of this food are some of the least financially secure. Health shocks hit them hardest because their incomes are seasonal and unpredictable, and without insurance or savings, they have nothing to fall back on when sickness or injury strikes. What is our solution? We've created the Green Pulse app. This is a mobile platform that connects farmers directly with investors and insurance providers. The idea is simple. Farmers' crop sales become the vehicle that gives them access to affordable, quality healthcare. For farmers, the benefits are twofold. Financially, they get investment opportunities that boost productivity, and health-wise, they gain consistent, reliable insurance coverage. Here, you can see our early wireframes. These designs show how the app connects with farmers with investors and integrates healthcare insurance features in a way that's simple and practical. Of course, our user has on user pain points and needs. Of course, we need to build trust. Like the farmers, when we presented the idea to some of the farmers, they had their own concerns. For example, we had Mr. Coffee who said, "I don't trust giving my money to a digital company." He also had another concern where he asks, "How do I know this will actually work at the hospital?" These concerns were valid and important. Our actions to solve his concerns involved one, partnering with trusted insurance companies and showing their logos clearly on the app, and the second, adding a trust and security section to reassure users. We'll also introduce a scannable QR code that acts as a digital insurance card, something tangible that farmers can present at hospitals. Finally, we will give farmers more control, letting them decide how their payment should go toward the insurance point. Our rollout plan has three phases. Phase 1, the first 6 months, will be with 100 farmers and 5 investors, plus onboarding an insurance partner and a few local clinics. Phase 2, over the next year, will add more features like direct messaging between investors and farmers and a simplified claim process. Phase 3 involves scaling up to other regions across Africa and working closely with government and agricultural agencies. The solution goes beyond a simple app. It's about creating a sustainable ecosystem where a farmer's hard work on the land directly translates to a healthier, more secure life for their family. This isn't just a business, it's a mission to build a healthier, more prosperous future for Ghana, and one harvest at a time. Thank you.